You might have seen this image on social media, used to illustrate how runners and cyclists may be spreading COVID-19 in still busy parks and public spaces. It caused an explosion online, with some claiming that running and cycling right now is irresponsible, and others calling out the researchers for releasing work out of context and without peer review. So, what's the full story? As with most things in science, context is everything.
As a scientist, I try to do things that contribute to a better society, and that does not include giving people headaches or making them anxious to go outside and running and walking.
Dr. Bert Blocken, the study's lead author, has been working on droplet movement in airflow for the past 20 years. His study has since been released online, but has not yet been peer-reviewed.
I got so many questions from friends, from colleagues. Can I run next to another person? How can I overtake another person when I'm a cyclist? Is that not dangerous? Should I hold my breath? And that actually was the start of our investigation. We said, okay, we are aerodynamicists, so we just look at droplets, and that's why we started this study.
The results of the simulation showed that in certain conditions, 1.5 meters was enough distance to avoid droplet contact. But as soon as those people were moving, that distance went up significantly, 10 meters while running quickly, or 5 meters at a walking pace. But to aerodynamics and droplet experts, it's not really a surprising result.
Before you sent me the link to the paper, I think last weekend or so, I was out cycling on the Steveston Dike, Richmond Dike, and it's fairly busy. So there was a nice cross-flow wind coming off of the land, and I was sort of mentally calculating the plumes across from everybody.
This is Dr. Steve Rojak, a professor of mechanical engineering at the University of British Columbia, who also studies aerosols.
It's a good piece of quality work. They've used modern methods, and they've been careful to validate their methods. You know, at the same time, the authors have been also careful about describing the limitations of the work.
He's talking about the full paper, which was released online days after Blocken tweeted the videos with just the results in them.
I think there's no aerodynamics person in the world that will be surprised of these results. We thought, okay, the risk of criticism here is quite limited. Well, we thought wrong.
There are a lot of factors unconsidered by that in press release, because that is not a study. I mean, I'm sure some simulations were done. It certainly appears that way, but the constraints of those models, like all the details that I would need to appropriately evaluate the relevance of that and to put that into some kind of perspective about infectious disease, they're all absent.
Dr. Josh Santarpia is an associate professor of microbiology and pathology at the University of Nebraska. He studies aerobiology, microorganisms in the air. His research into how patients were shedding viruses and viral RNA into the environments around them has already been influential in understanding COVID-19 and how to protect frontline workers from exposure, especially through the air. And that's been an issue that comes up again and again when discussing the coronavirus, whether or not it's airborne or just transmitted by droplets. But that distinction might not matter as much as people think.
Yeah, so I think there's a lot of miscommunication, and I think it's that sort of the airborne droplet distinction is actually fairly antiquated, really, because it's a spectrum, right? If you look at it from the perspective of what do humans produce during respiration, different modes of respiration, there's a wide spectrum of particles ranging from, hundreds of nanometers up to many millimeters.
Research has shown that the coronavirus can survive in droplets for hours in the right conditions. But we don't know how many viruses it takes to cause an infection, or how many viruses are in the particles that patients release, or how long viruses can survive in particles of different sizes. That's research that many scientists, including Dr. Santarpia, are working on right now. So when people see these videos online, it's easy to misunderstand and assume that they're looking at a completed puzzle instead of one small piece of an incomplete puzzle.
What I'm afraid happens is that people, without proper context, people just jump to whatever conclusion. It's like, oh, don't ride your bicycle because you might get exposed. That's the value of peer review in science, is that it helps refine the perspective of any individual study.
So having seen how people misinterpreted the initial Twitter posts and your work after you released it, will that change the way you release work going forward?
Good question. Now, yes. Because this was a bit exceptional in terms of media explosion. I've seen all kinds of things passing by on social media with people accusing each other and actually fighting even over this Twitter post. Yeah, that was not the intention. We do make mistakes in communication, and I, in hindsight, it's always easy to talk afterwards. In hindsight, I found the animations we made interesting, but I did not find them shocking. The problem is that if things get misinterpreted and it causes distress for people, well, that's not what we want to do.
I think that everybody in the academic community is trying to be as helpful as possible to the public in providing information.
Despite all this, Josh Santarpia and Bert Blocken's research both point toward the idea that we can't assume 1.5 or even 2 meters is a safe distance in all conditions.
I think it's become sort of this rule of thumb. Maybe it's appropriate for casual contact, like on the street or something. But in terms of like, if you put a bunch of people in the room, I don't care how far they are apart. Like, there's going to be some fraction of what they're, what they're exhaling that's going to make it to you.
Keeping that distance during necessary trips out of the house for exercise or grocery shopping is important to reducing contact and curbing the spread of COVID-19. But it's important to remember that it's about reducing your risk. It's not a magic distance that will always keep you safe.
Yeah, better safe than sorry. If there's no infection risk, fine. If there is infection risk, then better safe than sorry.
Maybe it means you should think about how close you're riding to the guy in front of you, right? It certainly made me do that when I went for a ride yesterday. But I also don't like to draft people anyway, so yeah.